India is facing a growing public health crisis, with rising rates of diabetes affecting both urban and rural populations, particularly among children. November 14th marks World Diabetes Day, which is an internationally recognized awareness campaign aimed at educating people about diabetes and advocating for better treatment and prevention efforts. While diabetes has been associated with adults traditionally, an increasing number of children are being diagnosed with type 1 and 2 diabetes, and with it comes vision complications. Type 1 and type 2 diabetes are both serious conditions that occur when the body has too much glucose in the blood due to an issue with insulin. In 2022, about 95,600 children under the age of 14 years in India were reported to have type 1 diabetes, according to the Indian Council of Medical Research. With this, India accounts for most of the children with type 1 diabetes in Southeast Asia. So, why are diabetes incidences in children increasing in India?
The main reason for this is increased in childhood obesity. This is due to the consumption of junk food, and this is coupled with decrease in physical activity. And this is not good for health because insulin is not able to work the way it should. Along with the food and the lack of exercise, there is also another interesting factor. In India, there is a lot of environmental exposure to endocrine disruptors which impact the activity of insulin and its ability to break down sugars in the blood. These endocrine disruptors are present everywhere. They are in our food, they are in our water, and also in the air that we breathe. These are chemicals which are present in plastics, they are in pesticides, fertilizers, and everything that is part of our environment.
This year's theme, Breaking Barriers, Bridging Gaps, reflects on the importance of removing barriers to ensure everyone, regardless of their location or economic status, has the support and resources they need for adequate diabetes management. What can be done to lower the risk of diabetes in children?
To reduce the burden of disease, it's important to create awareness about the kind of food that we need to give to our children. Along with that, there is a need for good policy also. For example, there is a concept of soda tax in which sugary drinks are taxed at a higher rate, which makes them much more expensive. There is evidence that this decreases the consumption of soft drinks. There is also a need to increase physical activity by providing open spaces to the children. There is a need to promote sports in schools and also provide places, safe places to where they can walk and play.
Addressing the need to adopt a preventive approach at a young age helps in building a secure future and reducing the risk of suffering from serious illnesses in the long run.